newly formed Oregon Cannabis Clinicians group joined the American Cannabis Nursing Association in Salem, Oregon, February 18, 2020, at Oregon's State Capitol building to advance excellence in cannabis clinicians practice through advocacy, collaboration, educational research, and public policy development.
I'm Michael Rochlin. I'm a cannabis nurse and on the board of the American Cannabis Nurse Association, also director of the Oregon Cannabis Clinicians group, which was founded last year as a state organization to promote excellence in endocannabinoid medicine, and that includes all licensed healthcare providers. And this evolved from conversations with Dr. Rachel Knox, nurse Rebecca White, myself over the last couple, 3 years. I've been doing this since about 15, advocating for patients, for patient rights and safety, and for license protection for clinicians like myself and other people. And so the course of events since Oregon legalized in 2014 has been a green rush, and being part of that evolution, I could see where the medicine might be really important to promote in terms of safety. And so that's been one of my primary focuses, is safe and clean medicine for patients. This accelerated last year, and then we had this vape crisis with mostly e-cigs, but there was some concern about the constituents of cannabis. And so not just cannabis itself, but for example in the cartridges where you had other substances mixed. We don't test for metals in this state currently, so that's a concern. And I've been testifying about that. And slowly I think this has evolved where the conversation has been enlightened, not only by that crisis that was about a specific substance in a specific container, an inhalant container, but also about the purity and also the evolution of the hemp bill that was signed in 2018. Even though we had a hemp law in this state, it was a pilot, so that had to be resubmitted. So this has all come to a head last year. And finally, this year, with a short legislative session, found that there was a receptive audience for the Oregon Cannabis Commission, which issued some recommendations. So this all has been happening the last 2-3 years anyway. But the Oregon Cannabis Commission, look that up. You can Google that and find the legislative report that was issued in January of 2019. It's taken this long to actually get that embedded in legislation, which was Senate Bill 1561, sponsored by Senator Brzezinski and co-sponsored by Representative Helm. It had a lot of things in there, but specifically Section 42, which had to do with provider-neutral language, so we could have nurse practitioners that are basically primary care providers, as well as naturopaths and physician's assistants, enabled by statute to be clearly able to deal with cannabis as medicine. That hasn't happened before. It's overdue, and I think our legislature now is coming to understand a little bit more about the scientific evidence there is, and what we really need is more empirical clinical evidence, and that's what we're working on. And I think with having nurse practitioners and naturopaths involved, we can get a better handle on that, because they will be, I'm a firm believer on them embedding this into their clinical practice, so it's not just by law, but it would be a change in policy. And that's what I'm really interested in on the ACNA, the Cannabis Nurses Association. The president asked me to focus on policy, because that's what I've been doing, and so I'm really excited. And we have nurses here that are willing and able to be part of that continuity and broaden the message out. And as nurses, that's what we do, is educate, advocate, and focus on clinical evidence. So this is wonderfully evolving, and we're hoping it continues to evolve, hopefully at a much faster pace, but realizing that not everybody understands this issue, just like climate. It takes some people that are willing to hear the message, and really you can do your own research, but then talk to professionals, the professionals and scientists that deal with this. Really understand it, and I think that's where some of the communication maybe is. There's a gap, because as professionals, as medical professionals, scientists, researchers, educators, we may speak a little differently, and so some of that communication is evolving too, to make this message not only simple enough, but where can we find that information easily? There is no one spot, I think, in the state, and that was the original purpose of the Cannabis Commission, was to help solidify the basis for using cannabis as medicine. And so that and this equity in health, equity in social, to help uplift communities that have been harmed by the war on drugs, and those kind of things are embedded in the Cannabis Commission's work. And I'm pleased to see some of those coming out in legislation this year. I think there's a really a deeper sense of understanding and commitment now, not only in the House but in the Senate. And when I testified on Senate Bill 1561, Section 42, which had to do with provider-neutral language, there was unanimous agreement that bill should be passed, but I also heard a specific question about that was answered. So I know they're listening, and as constituents, we want to reinforce that message that we're happy about that and pleased to promote patient safety and patient rights. So please, whatever you can do to be involved, if you're a practicing healthcare clinician, specifically nurses, I'm chairing the policy committee, so please get in touch with me. Other people that can support us and support this effort. Patient donations are important. We have a pathway for that. And also for research. We're interested in doing research on adequacy of certain formulations. And so any of these things, mdrochlin@gmail.com, mdrochlin@gmail.com is my email. I'll be happy to respond to you. Thank you.